All right, let's turn our focus to this now. As a National Youth Month draws to a close today, the mental health and the well-being of young nurses is set to be a critical talking point at the upcoming 5th African Nursing Conference. Nurses in the country are faced with difficult working conditions coupled with reports of health facilities targeted by crime and violence. The safety of nurses as they carry out their duties has been raised as a concern. Well, to speak to us about young nurses and mental health, we're now joined by Ms. Mpadi Makgalo, CEO of HEAL South Africa. A very good afternoon to you, and thank you so much for your time. Paint a picture for us in terms of just the challenges that young South African nurses are facing on a daily basis, especially as it relates to mental health concerns.
I think first of all, we have to remember that the nurses are the heart of the healthcare, and their mental health is very, very pivotal to them carrying out their duties. So what we have been able to assess as HEAL SA is the high rate of burnout, anxiety, depression, stress, PSTD, and this, of course, was the result of COVID, that some nurses have not been over it because they were the caregivers and they provided us with the healthcare needs that we needed at the time. But they also went through a lot of trauma. And we know that there's also high rate of sleep disturbances, frustration and helplessness of the current healthcare infrastructure, where you have, you don't have resources for you to do what you need to do on a daily basis. And of course, we are also seeing, because of all these high rates of substance abuse within young nurses because of their inability to deal with the stress that they are confronted with on a daily basis. And of course, this has a serious, it's a serious mental health problem for our healthcare system.
When we look at the overall healthcare system, of course, we know and we see just the many challenges that are emanating from this particular profession, affecting, I must say, professionals across the board. But I want to focus on the young nurses, particularly coming into this space. What are some of the mitigating factors, do you think, the healthcare fraternity itself can do, especially for young professionals coming into this profession?
I think the big, for me and for us as HEAL SA, I think the big issue is how the system has to be very intentional about providing mental health support for nurses. We always talk about nurses dispensing comfort, compassion, and care, but who is there to provide this service? And I think maybe having a very robust mental health program that really focuses on young nurses. Remember, we're talking about 23-year-olds who are still navigating themselves as young people and are still not sure of themselves. So having a system that can support them in it could be a helpline. It could be that you create support groups within the fraternity, but mostly to just also we see a lot of stigma around accessing mental health services for these young nurses, to also run campaigns to make it okay for them to ask for support. I think as caregivers, they always want to be there, being very supportive, but to also encourage the whole idea of self-care, which is very important.
How important do you think speaking about healthcare will be, particularly when we look at the 5th African Nursing Conference 2025 that is happening next month? Will it be something that is going to be prioritized, especially when you look at, it's just some of the themes, empowering nurses as catalyst for health equity?
Yes. Exactly. And I think for me, that really draws it very close to say we can have these bold initiatives and these bold, promises that we are talking about, but we have the workforce, the nurses themselves are not equipped to deal with themselves. So how can I support this system and this these ideals that we have around universal care, whereas the nurses, which are the heart of the healthcare system, are not emotionally equipped to do so. So for me, that is very, very important that we're able to do that, to really talk to mental health as we are looking forward to this fifth annual nurses conference in Birchwood.
And the conference does come at a time where there is quite low morale, amongst nurses, but also the healthcare fraternity as a whole. I mean, how important is it to draw back, particularly to the public perception, about the importance of this role?
And I think the question that you're asking is very imperative, because with the burnout, we see a lot of young nurses wanting to leave the profession. And I think it's very important to then look at how you resuscitate that, how you get the nurses to be interested in their careers. I think for me, it is front and center to have a policy or a way that we can actually get the nurses to be back excited to be nurses and to look forward. And to, for me, it's even just the basic, like, can you secure the safety of nurses? Can we make sure that we have healthy work environments and so forth, so that can alleviate some of the stresses. So just even making sure that the workspaces are equipped for nurses to come and do their work without having to worry about their own physical well-being, which affects their mental well-being.
All right, Mpadi, thank you so much for your time. Really do appreciate it. Mpadi Makgalo is the CEO of Heal South Africa, just talking there about the effects of safety, particularly around young nurses in South Africa.